All right. Good evening, uh, everyone. Good afternoon, good morning, depending on where you're coming from today. Um, Welcome to Lightit's and DHI's fourth roundtable. It's a pleasure to have you all here today. We're focusing our discussion today on innovating with AI in healthcare systems. I'm going to make a very quick introduction, and then we'll get started. So first, I'd like to introduce today's sponsors. We have this roundtable organized by Digital Health Insider, DHI, and Lightit. DHI is a health tech newsletter that delivers weekly insights on the industry, offering up a curated list of the top 10 most relevant news items per week. And if you haven't registered, please go ahead and do it. And we'll have a link for you shortly as well to be able to do that. And at the end, and Lightit. Lightit is a digital healthcare product agency, and we create custom web and mobile applications for the healthcare industry. We have a really exciting agenda for us to go through today. We're going to start discussing AI as a solution, then go on to discuss when and how to use AI, and then moving on to the biggest challenges healthcare systems face, and finally cover off how to approach healthcare systems. We're then going to finish off with some time for questions and answer. If you have any questions, please write them down in the Q&A section, and we'll get to them at the end. Depending on the questions coming in, we might curate a couple to focus on, but please share some of those questions with you. And before we begin, we're going to introduce ourselves to you. I'll start off. My name is Dael. The longer you get to know me, the more I talk about wine and food and other things like that. But for the purpose of this conversation today, I'm the Managing Director, North America for Lightit, and really pleased to be here moderating some exceptional guests that we have today. I'm going to ask those guests to give us their background in the healthcare industry, and we'll start with you, Rachel, and then move on from there, please.
Thanks, Dael. I'm Rachel Tornheim. I have been working in different parts of the healthcare industry in New York City for the last 14 years. I worked at 2 different health tech startups, 2 health systems, and 1 payer. So I've seen the industry from a number of different sides. And most recently, I've been head of consumer digital innovations at Mount Sinai Health System. This is a 30-person team within the health system that built and implemented a custom patient engagement platform.
Amazing. Thank you. Joe.
Thanks, Dael. Well, very excited to be here today. My name is Joe Ferrara, and I have 7 years experience selling to health systems throughout the United States. Most recently, I served as Senior Director of Sales and Customer Service for an innovative life sciences startup called Secure Transfusion Solutions. And I'm currently the founding customer service lead at another startup called Pharmacist Healthcare Dashboards, also known as PHD. In addition to this, I also work as a consultant with early stage companies looking to get a foothold in, in the world of creating partnerships with health systems.
Amazing. Thank you. And last but not least, Scott, please.
Hey, thanks for having me here. Super excited to be with you all. I'm Scott Nelson. I'm an associate professor in biomedical informatics at Vanderbilt University Medical Center. I'm a pharmacist by training, and I've been working in informatics for the past 11 years, where I specialize really in medication safety informatics, a lot with e-prescribing, clinical decision support, and those kinds of things. Vanderbilt is a large academic medical center system located in Middle Tennessee. We have 7 hospitals, over 200 clinics, and see about 3 million patients per year. In addition to my duties in Health IT, I also am the program director for our Master's of Science in Applied Clinical Informatics. It's an online program that we offer there too.
Amazing. Thank you. It's so awesome to have the 3 of you make me definitely realize that I am the least smart person in this conversation. So thank you. All right. So we're focusing on AI in healthcare systems, and just want to frame some of the what around this topic as we start to get into some of the discussion. And, innovation as a concept or practice isn't new in healthcare. Without it, novel treatments, the MRI machines to mRNA, without innovation, these things would never have happened. What we are seeing, though, is innovation moving from more of a behind-the-scenes, siloed, experimental culture to something that is a bit more front and center role within healthcare, and that the term innovation has a much more immediate feel to it. We're not talking about creating complex new healthcare approaches that take years, but we're talking about accelerating, streamlining, and making healthcare more accessible now in more immediacy. And specifically within innovation, we've seen AI not just appear in a discussion. It's not tangential to our life, but it's dominating almost every aspect of our lives seemingly over the past year. Every conversation that we're having, every startup that we see coming out that's being founded and then funded, conference themes, AI is central to all of this. And AI in our jobs, we're all, I think, finding amazing ways to be able to use some of these tools in our jobs. And it's all happening at a speed that we've never, ever seen before. So some of the examples that I can give you to frame this discussion now, in doing some research for this, we were looking and seeing at least 110 health systems have set up innovation centers in the US. And this is accelerating, is enabling the acceleration of new products and services, often from providers and entrepreneurs within those health systems. AI is powering automated screening of CT scans to provide earlier detection of lung cancer, for example. 12x reduction in time, 12x reduction in time in treatment to get to treatment was achieved by the Mayo Clinic Center for Innovation by applying AI tools and algorithms. And these health systems that are coming up with these novel solutions and then spinning them out. 1B was the IPO for a spinoff from Penn Medicine Innovation Center. So framing some of the what around innovation and AI in healthcare. Scott, I'd love to ask you, why is the proliferation of AI so important to healthcare users across the board? You know, patients, providers, health systems, payers, etc.
Yeah, for sure. And like you mentioned, AI is kind of getting into everything that we're doing as a society. I would say more specifically in the healthcare realm, there are some major factors that are playing into this. One of those is healthcare workforce shortages. So we've seen massive shortages in nursing, also in physicians, radiologists, pharmacists, respiratory therapists across the board. So that's kind of put a lot of pressure on the health systems. There's also clinician burnout. In addition to that, we have a survey from the American Medical Association that said that about 63% of physicians have experienced burnout in the past year, which is way up from previous years. And with all of this going on, cost is also super important. Healthcare accounts for like 18% of our gross domestic product in the United States, which is a ton of money. And so there's a lot of pressure on health systems to operate on lower margins, to cost contain. And so that puts a lot of pressure on these health systems to try to find ways to be more efficient. And then there's also the ever-increasing complexity of healthcare. It's estimated that medical knowledge doubles every 73 days or so. So we've just seen this exponential growth in the kinds of factors that you need to make decisions for patient care. Genetics, social determinants of health, whole person health, just on and on about all these factors that go into making good decisions. And so AI kind of has this promise of helping to improve efficiency, help decrease costs, and help manage a lot of these complexities so that our clinicians can take the best care of their patients possible.
Yep, well said. So with that info, Joe, who do you see in your experience that are the key players in this emergence?
It's a good question, Dael. So some of the nation's largest health systems right now are taking a lead on that have been early adopters of AI solutions in various ways. So I see them as leading the way right now. But I think one of the critical things that they're focused on, and these are some areas that are really ripe for innovation, as Scott mentions, are the staffing shortages and the administrative burdens. And so I see solutions that really address these issues as being fundamental. And these are really some of the areas that could be quickly improved by AI in really concrete and measurable ways and can demonstrate ROI almost immediately. And in some ways, this is a great way to kind of ease our way into AI. So I just wanted to throw that out there. But moving back to who the leaders are in this particular space, with regards to health systems, I've made a list of a few that I think are leading the way. Number one is Banner Health, and they're a very large health system based in Phoenix, Arizona. They span over 6 states and have over 30 facilities. And they've recently partnered with a company called Regard, and that they've built a software enabling physicians to quickly and easily access all the information that's in the EHR. And so this frees up a lot of time for them to spend with patients face to face, which is what we want them to be doing, rather than kind of behind their screens the whole time when they're interacting with patients. So I see this as a really positive development and a move in the right direction. Number two would be Johns Hopkins. So they recently partnered with GE Healthcare to use predictive AI for their emergency rooms. And so what they did was they put together a committee, and what the committee worked on was finding better ways to quickly and easily triage patients and get them admitted to ER beds as quickly as possible. And they use AI to augment the work of that committee and to speed things along. And they saw 30%, actually it happened 38% faster getting patients in the ER admitted to beds with this program. So really that's an augmentation of the work of the clinicians, which I think is great. And finally, to bring this closer to home, at least for me, here in New York, one of the leading health systems and the largest is Northwell, and they're a big player in the local market. And they've actually signed a deal, which seems like a long time ago now, way back in 2023, with a company called AI Doc, and they've enabled enterprise-wide clinical implementations of AI across 17 hospitals. And that involved the implementation of AI Doc's operating system, which is called AIOS. And what that does is optimizes clinical workflows for patients. And that's something that's helping to improve patient care, creates greater efficiencies. And they've also created kind of a partnership with another company to launch healthcare AI companies to address issues like access, quality of care, and kind of fill in some equity gaps. So they're one of the big leaders in the space as well.
Fantastic, thank you. You know, healthcare is risk averse as an industry, and rightly so. So as we have innovation and just this profound sea change with AI coming into the equation over the last little while, are we creating new areas that haven't been thought of or tested before? Is a question that I know a lot of people ask. And going along with that, you know, how do these new technologies affect privacy, security, general legal protections, etc.? And Rachel, I'd love to get your thoughts on that, please.
Sure. Yeah, I think there are a lot of open questions on the legal side, especially questions around patient consent, questions around liability. As you mentioned, Dael, health systems tend to be very risk averse. They tend to be slow moving. They tend to err on the side of overly checking and making sure they don't tend to be the first to implement something brand new. So even before this recent explosion in new AI technologies, when I was at Mount Sinai working to bring vendors in, there was a very concerted process to review new vendor requests. And you can bet that folks from privacy and folks from legal were part of that process and had the ability to raise concerns and to prevent things from moving forward if that was warranted. So I'm not concerned that hospitals are going to move too quickly. And I do see a lot of hospitals, in addition to having that standard process, now with the explosion in AI, setting up dedicated governance structures around AI specifically. And you can bet that privacy and legal are going to be at the table in those as well.
Yeah, it seems a really good time if you're in law school or recently graduated to make sure this is a focus area for you. Definitely jobs created because of AI in these areas that you talk about in terms of policy and other things. We've mentioned a couple of companies in our discussion so far, a couple of examples, some data and research that we've done. I just want to let everyone know that we'll be sharing this out as a video of this that you'll be able to download at the conclusion of the event, and also follow-up materials that we'll be sending around. So if anyone's looking for any of this information, we will be sharing it with you. All right. So now I'd like us to spend 15 minutes or so just discussing when and how to use AI in healthcare systems. So, it's great that we have ideas, we have solutions, we have opportunities to be able to use AI or propose how to use AI and these healthcare systems. Then we've talked about some of them, they're very, very large, but also looking to take on board some of these solutions. So Rachel, I know, and you have a framework, and we've gone through this, we've talked about this previously, of how healthcare systems can think about risk with regard to implementing AI. And I'm wondering if you could take a couple minutes to walk us through that. Oh, you're on mute, Rachel.
My mistake. This is a framework that I developed to look at some different drivers of risk that health systems face when implementing AI. So we've got a continuum from less risk on the left side to more risk on the right side. The first driver is, what is the task type that AI is looking to support? So on the low risk side of things, we've got back office tasks. These are things like billing or procurement or recruitment, really very little to no impact on patients. Slightly more risk is front office tasks. These are things like scheduling, for example, where there's nothing clinical involved, but there is patient interaction. And so if that goes wrong, health systems are going to be more concerned with the outcome. Farther toward the higher risk side, we have patient care operations. So these are some of the administrative tasks that clinicians do as part of their process of delivering care, but not things that are directly clinical in nature. So this is things like writing notes in the chart, for example. And then finally, the highest risk side, of course, is the actual delivery of care. So here we have clinical decision support tools that might make recommendations for care. They might suggest diagnoses. They might analyze images. Second driver of risk is the type of AI model that's being implemented. And there are a lot of different taxonomies here, but the distinction I'm drawing here is deterministic versus non-deterministic models. With deterministic models, for a given input to the model, you're always going to get the same output because the rules have been explicitly coded by the humans who built that system. So because the output is 100% predictable and we know what it's going to be, those are lower risk implementations. On the higher risk side, we have non-deterministic models, and this is where machine learning algorithms, including generative AI, falls. Because the output is not known at the beginning, and you could have hallucinations, you could have some variability, that's going to be higher risk. And then the third driver of risk is the level of oversight. So obviously with low risk, you would have full oversight where every recommendation from a model is reviewed by a human and the human decides, are we going to go with this or are we not going to? You could have an option in the middle with some oversight. So maybe if a model says there is a 0% chance that this particular scan shows a malignancy, maybe the health system decides we don't need a human to review that. But if the model says, ooh, 50% chance there's a problem here, you have a person reviewing that. And then finally, on the highest risk side, you could have no oversight. And we're not seeing a lot of implementations on that. So as I've looked at different implementations of AI in health systems, I am not seeing anyone do implementations where it's high risk on all of these elements. Typically, if you're doing higher risk on one element, for example, you are using clinical decision support, you are having more oversight. Or if you are wanting to have less oversight, maybe you're using a deterministic model or you're implementing with lower risk task categories.
Fantastic, thank you. Joe, as we look through then risk and levels of risk, obviously we look to prioritize value and benefit. Where do you see the highest value use cases for AI in healthcare today?
Right, well, we spoke already about the AI reducing administrative burden and sort of operating behind the scenes. So I think in addition to that, Rachel touched on, diagnostic tools. I think there's definitely some potential there, of course, with some caution. And I came across a really good example. There's a company called Rad AI, and they're using AI to generate radiology impressions that are customized to the language used by each radiologist. So it kind of learns how you do things and set things up, and then it'll help you to generate those reports. And this is a lot of administrative work that takes a lot of time, from clinicians. So they're claiming that this could help save up to 60 minutes per shift, which is significant, per radiologist. So, and that improves efficiency and accuracy. So these are all great things, but of course it does have the oversight component. And I think this is one of the themes that a lot of the good collaborations that I've identified share, is that they're using AI as a tool to augment the expertise that's already there with the clinicians, and in some ways to make their job easier, potentially reduce burnout, and of course, to ultimately improve patient care. That's what this is all about.
Exactly. Great. Some other use cases that I wanted to mention, just coming out of Lightit's innovation lab, two tools or products that we have created that are now sort of in the field and being used are Puppeteer and Compliant Chat GPT. And Puppeteer, it allows healthcare organizations to utilize conversational AI to enhance the providers and patients' experience. And again, there's a lot of efficiency, a lot of sort of meeting patients and providers where they are, and fitting in a tool within a workflow there. And then Compliant Chat GPT is a platform that allows you to use OpenAI GPT models in a HIPAA compliant way. So I'd be remiss if I didn't mention that we have a view of how we think that we can be bringing products into some of these systems as well. So Scott, what best practices are you seeing that are being employed to harness the power of these emerging technologies? And do you have any critical do's and don'ts?
Yeah, for sure. So when I think about these algorithms and AI models, I kind of put on like my pharmacist hat and think about new medications coming to market. And really, in order for a new medication to come to market, you have to establish safety and efficacy of the drug. And the Food and Drug Administration, or FDA, has kind of established this framework of software as a medical device, where it kind of flows through the same kind of structure or review as a medical device or a drug would coming to market. And so I think that's a really helpful model, because it helps us to make sure that the things that we're doing are safe and effective for our patients. We've seen other places where they've implemented AI models and for whatever reason have seen an increase in mortality and had to like shut them down. But I agree with Joe in that really those kind of more administrative tasks, those lower risk kind of tasks, are really where we can see a lot of benefit from AI. And so that's really helpful there. I would say, as far as the do's, do take your time to do a thorough evaluation of the whatever model or product, especially with respect to cybersecurity and patient safety, like Rachel is mentioning. And do be mindful of costs and maintenance going forward, because when these models are implemented, they tend to drift over time. And so you have to be thinking about, how am I going to maintain this over time and going forward? As was kind of mentioned before, also, do establish some sort of AI governance group or structure for review and approval of these tools. That's really helpful in making sure that things are done in a safe and effective way. And then do use your critical thinking skills in approaching these things, especially with a healthy dose of skepticism on potentially some of the claims. And so that's really helpful. For don'ts, I would say, don't jump into all the hype that's going around AI. It seems like everything has AI now. And just because it can have AI doesn't mean that it should or needs to have AI. It sounds really great, but like, I probably don't need AI in my toothbrush. Like, I can probably manage that myself. Or AI-enabled pet chew toys, or all sorts of kind of things that we're seeing. And I would say don't focus on doing the overly complicated tasks, or trying to like completely replace clinicians. I think that's kind of a misguided direction. As was kind of mentioned earlier, I think a healthier term for AI is augmented intelligence. And so what are the things that we can do to help facilitate the workflows? Radiology is a really interesting example, where there's kind of been a push to, let's replace radiologists, but then all their models are not able to replace radiologists. They could probably do one task really well, but they can't do all the things radiologists can do. And so we've seen more of a shift into, okay, how do we help facilitate the radiologist workflow? and how can we help make it easier for them to do the things they need to do?
Awesome. You just killed my AI toothbrush startup idea, but coming from a family of dentists, they're probably not wanting anyone to go into that.
It's
that
already
area.
there. You can already
Is
get
it?
it.
Okay.
Yeah,
Okay. I'm sure
it's a
you
real
can.
thing.
I'm sure you can. I loved two of your points here. Your last do and your first don't. The last don't was don't just jump into all the hype around it, and the last do was use your critical thinking and skepticism. And I think as impactful and incredible as the emergence of AI is, it doesn't change the fact that it won't solve everything, and you still do need to think about what you're really trying to do with it. So that same skepticism and curiosity and everything else that we've brought to the table before AI, it still needs to be there, right? It's not such a change that you can't do the things that you were doing before. This is an augmentation, as you point out. So I love that. Thank you. Rachel, I'd love for you now, as we're talking about this, how are innovation centers inside healthcare systems, how are they taking this on and boosting growth through these tools?
Yeah, so I see two chief types of innovation centers within health systems. One type is trying to build solutions themselves, sometimes with the goal of spinning out to be a separate company. And then another type is more acting as internal consultants, researching external solutions and kind of advising internal departments and helping to implement things. With the first type that's focused on building solutions, there's kind of a mixed track record there. So some health systems have been very successful in creating new AI products and spitting them out. Other health systems have tried to do some work there and then have ultimately rolled that back and realized that the core competency to build and launch software products may not be where they want to make their investments. In terms of the second type of innovation center that's more a dedicated team focused on assessing and helping to implement appropriate AI technologies, I think that can be a very smart approach. So often these groups are kind of surveying the landscape, researching different solutions, assessing their applicability to their particular institution, working with different departments inside the health system to understand their pain points and their needs and see where they might be matches, and then helping to manage that process of that department assessing different external partners, bringing them in, doing some contracting, and then ultimately managing that implementation and measuring success. And I think this can be really effective because if you don't have a team that's focused on this, it's going to fall to the leadership of individual departments, whether it's the person who runs the call center or the person who runs the radiology department, to try to be researching different solutions and moving things through. And that's going to be difficult for them to find time to do it. It also may not be their skill set. So where health systems sort of have the ability to have this additional team that's really dedicated to these efforts, I think that can really help them to smartly implement new solutions.
I think something that you've keyed in on there is that holistic view of a healthcare system with shared strategy of what they're trying to accomplish, as opposed to individual groups or even individuals within the organization that are trying to take something on. So I think that's important to note there as well. Thank you. As we're halfway through, just want to remind everyone, thanks for being with us, first of all. And if you have any questions when we get to the end in the Q&A, so again, please put those through into the Q&A. So biggest challenge in healthcare systems and how to overcome them with AI. This is an area that we're going to spend 10 minutes or so talking about this now. We've talked about when and how to use AI in healthcare systems and some of the ways that can drive immediate impact, or maybe less at the diagnostic level and more on the front line with workers, providers. We talked about augmenting, some of those back office clinical tasks. And that's an area, again, low risk, but high value probably. And if we take a look at physician burnout, which we've also called, or I'll just say clinician burnout, we've called that out several times as something that is just very obvious and transparent. More data, a recent survey published by Athena Health in February found that 90% of physicians report feeling burned out on a regular basis. And Dr. Jesse Ehrenfeld, president of the AMA, he talks a lot about the US being forecasted to be 100,000 physicians short by 2034. So obviously these are huge challenges to be overcome. And Rachel, again, I'd love to just get you to continue on with some of your great thoughts on the trend that we are seeing here and your observations and insight into how this can be reversed.
Absolutely. So clinician shortages is a well-documented challenge. Scott spoke about some of the different categories where those are especially dire. We're seeing a number of AI tools that are looking to help address that. So for example, for physicians in particular, we're seeing some tools that will summarize a patient chart to help make it faster for them to get ready for a patient visit. We're also seeing a lot of these ambient AI tools that will listen to the patient visit and then draft the note for the physician. Creating these notes after visits is one of the biggest drivers of pajama time, where doctors just have a pile of administrative work that they have to catch up on at the end of the day when they're home. And that's a big complaint of doctors and probably one of the drivers of burnout and hence shortages. For nurses, I've seen some tools that help nurses if they are using text-based applications to communicate with patients. I've seen tools that will use generative AI to draft responses to patient questions. And so that can increase the efficiency of the nurses, where they don't have to manually write each message from scratch. They can sort of edit the draft and send that over. And then we've also heard a couple of folks have mentioned the machine vision tools that can analyze radiology or pathology images, and those can really improve the efficiency and throughput of radiology and pathology departments, where the clinicians are just reviewing what the AI has already drafted and signing off on it or making edits versus having to start from scratch. And I think all of these tools that increase efficiency, they're trying to get at shortages in two ways. One is that if you increase efficiency, you can do more with fewer people. But second is that by taking some of this burden off of the clinicians, especially some of those administrative tasks, hopefully you improve their satisfaction and reduce some of the causes of the turnover that you're seeing. And then one other category of AI that I actually just saw a company that does this earlier today is looking at the need for departments to fill shifts. So whether that's nurses, whether that's phlebotomists, when there are open shifts right now, that's a big administrative task for department managers to try to reach out to folks to see if someone can take an overtime shift or go to agencies. And this company used AI to do dynamic incentive pricing for the shifts and sort of offer those to different pools of people in order. And they were able to show through a pilot that they reduced the dependence on agencies, and they were able to offer more overtime slots to internal folks, improving their satisfaction and then helping to address those shortages.
Incredible. So taking surge pricing to the payment of your staff. I saw an example last week of a company that was testing out taking a look at the weather trends, taking a look at events that were happening in the city that weekend, taking a look at just all these different types of data to be able to see, can we forecast that we are going to have a busier emergency room this weekend than versus last year. So again, just a lot of like predictive analytics and forecasting tools as well. Thank you for that. That's great. Scott, what would you, if you wanted to take on and pick up from that and some of the tools and technologies that you see that are having a major impact?
Yeah, I would say that the stuff that Rachel mentioned really covers it really well. A lot of documentation to help with burnout. I think voice to text has been like a game changer in the past, and I kind of foresee large language models and generative AI helping facilitate that. One of the things that's really interesting to me, though, is with the implementation of any technology, it's always like a two-edged sword. There's benefits, but then there's also unintended consequences. And so we just need to be careful in how we implement things. And so just maybe riffing off of an example or a couple examples Rachel gave. So there was an organization that had an AI algorithm help to read chest x-rays. And if it was normal, it would just like create a report and the radiologist wouldn't ever see it. So the idea was, let's decrease the number of chest x-rays our radiologists have to read. What ended up happening, though, is they put more complex images to the radiologists that typically take more time. And also, they were expected to do more throughput now, but they had more complex images. So that was like a huge dissatisfier for that group. On the other hand, the generative messages or composing like a draft message to respond to patient complaints or comments. I was at Epic's expert group meeting, and they've been doing a lot of like work in this space. And one of the things that they noticed was that looking at the time people actually spend in the messages didn't decrease. So there were really no efficiency gains with drafting messages. However, what they did see is that it felt like it took a lot less time to respond to messages. There was this interesting decrease in cognitive burden and having to respond to messages. If something's drafted for you, even if you have to erase everything, just having something like drafted for you really was kind of a satisfier. So the psychology of how we're implementing the AI stuff and kind of that human factors stuff, I think is really important. So what are the kinds of things that we're doing to help not just improve efficiency, but make it a more pleasurable experience?
Yeah, I love that example, and a way that I framed it before is, you know, if I'm riding my bike and I get to a stop sign, I have to start pedaling all over again. I'm like, oh, I wish I had a little bit of momentum at the bottom of this hill, right? And I think that those generative messages that are there for you, it reduces some of that friction of like, where do I start? What do I prioritize on? And there's things there that allow you to very quickly go in and go, okay, that's not what I wanted to say or do, or this is something that I can build on. So I love that example that you've just given there. Thank you.
And even if it takes the same amount of time to reply to the messages, at least it's a decreased cognitive burden. It feels
Exactly.
like it's less time.
Exactly. All right, we're going to move into our last focus point of this roundtable, which is approaching healthcare systems. I see that we have a few questions that have come in the Q&A. That's fantastic. I'm going to post a couple of questions to our panelists now in this section, and then I'm going to quickly look through those questions. So in about 5 minutes, I'll take a look at the questions that are in there, and we'll prioritize which ones we have time to answer at the end. And then anything that we're not able to answer, we'll pull together some information for folks based on what's asked, and make sure that we send that out to you as well. So again, you've got 5 minutes, if you don't mind, to put any other questions in there. All right, so now we've talked about what healthcare systems are doing. We talked about what they might want. We've talked about what their needs are, and we're all looking to try and get our solutions and our products and our ideas inside these healthcare systems. And we know that they're not an easy group to work with. They're large institutions, oftentimes entrenched, bureaucratic, risk averse. We've talked about this before. And if you're selling into them, it's very often a long sales process. But the impact that these systems have because of their size and scale and the value that they can bring, that impact is immeasurable. Rachel, you've been in a health system yourself. Would you mind setting the stage for us on how these systems are typically set up, and what are their motivations?
Yeah, absolutely. So to reiterate some of the elements that have been discussed, health systems are typically very large organizations. Even a single site health system, around 10,000 employees. Mount Sinai or an NYU, 40 to 50,000, and really big ones like Northwell, 80 or 100,000. So when you think about the size of your organization, if you're at maybe a startup, maybe it's 50 people, 100 people, it's a very different dynamic at a much larger institution. Couple of implications is that folks in different departments may well not know each other, and different departments are more likely to have very different goals versus at a smaller organization where there's more of a sense that everyone is pulling in the same direction. Second characteristic of health systems, they tend to be very old organizations. So, very few of them were started in the last 10 years, right? A lot of health systems have been around for at least a century. And so the implication of that is that they have a lot of established processes that they've been doing for a long time. They may be very attached to. And so if you're trying to sell into them, it's usually best to try to defer to their processes rather than trying to get them to adjust. And it also means that they tend to have a little bit more of an old-fashioned culture. For example, health system executives usually show up to meetings in full suits. And so if you're from a startup, probably don't wear your shorts and flip-flops if you're going to have a meeting with a health system. Third characteristic, health systems are usually pretty financially constrained. So this is not a highly profitable business to be running. They usually have low single-digit margins if they have positive margins at all. There's a lot of budget constraints. And so the implication of that is they don't have a bunch of money burning a hole in their pocket. You're going to need to make a very strong financial case as to why investing in your solution is going to make sense from a budget perspective for them. And then a fourth characteristic is that they're highly regulated. So they're in healthcare, of course, which has a lot of regulations, but one additional spin with health system regulatory environment is that their auditors frequently show up in person unannounced to do audits. So as a health system employee at Mount Sinai, I would frequently get emails that says the Department of Health is on site at this location or Joint Commission is here today. And so that also really contributes to a risk-averse culture, which makes sense. So all of these factors really contribute to health systems being slow-moving and risk-averse. That means it's harder to get in, but it also means that once you're in, you're really going to have an incumbent's advantage because they're going to be averse to switching away from what they're used to and trying someone else.
Yeah. On the financially constrained, I know coming out of COVID and all the money that was available during then and deferred payments and being able to get equipment and all those things, a lot of CFOs of hospitals and health systems that I've talked to over the last year, talking to them about how, what is it they're looking for, and to a person, like if there's no ROI that's going to be showing itself within 12 months, then don't even talk to me, because we're no longer on a that might pay off for us down the road. So I think that's a really critical one to focus on.
Absolutely. Improving quality, improving patient experience, that's great. But if you cannot accompany that with cost savings or additional revenue or translate that into a financial ROI, it's likely to be a non-starter.
Yeah. Joe, you've sold to healthcare systems in the past. We know that approaching them can take various forms. We wanted to sort of do a little bit of strategizing today for our guests. Wondering if you can tell us a bit more about your recommendations on how to approach them. How would you start off engaging with them?
Sure. Yeah, happy to, Dael. So a few strategies. Maybe I'll start with saying there's a few broad strategies that I've implemented over the years where I found some success, and I want to share those. And before I close that out, I'll also share one very tactical piece of advice with everyone. But I think the first thing, and it's probably the most important, is to be open to having conversation with folks at all levels of the health system. And this is especially critical for early stage companies. So you're first starting out, you're not quite sure who the right audience is for your product or service necessarily. That sometimes you have to find by trial and error. And as Rachel mentioned, health systems tend to be large. So honestly, even if you're able to pinpoint within a few individuals, they may not necessarily be the right contacts once you start going. So really be open to having those conversations. And that will allow you to uncover pain points, which is probably one of the most important things. You can see if your solutions are a good fit, so that you'll be able to tell right away, is this a problem that this prospective customer even has? Is this something they're concerned about? Is this on their radar screen? So a lot of these things are going to come out from these early conversations, so they're really beneficial. Next, you may even be able to glean some valuable insights in terms of what other AI solutions has this health system implemented or is in the process of implementing. So that may guide your approach, may give you some ideas about how to move forward. And finally, for this first point, really having these early conversations allows you to perfect your pitch. Because again, if you're just starting, you're going to need to spend some time doing that, uncover potential customer objections. Hopefully you can get to those early and be able to counter them or to solve for those problems. They may point out there could be some problems with your model, your product, or the way that you're presenting it. So again, these are all really good experiences to have. And this is a gateway to valuable opportunities. You never know who you could be connected with from these early conversations. So super important. Number two is you want to identify your champions. So as you move through the health system, you really want to find your champion. Who is that person? That's someone who's going to be using it. It's a clinical user or it's an administrative user. They're going to be touching your product. They're going to be interacting with it every day or maybe at least a few times a week for their job. And they're your ideal champions because if it could improve their workflows, if it could demonstrate ROI, if it could make their job easier, result in greater patient satisfaction and outcomes, these are your natural allies, and they're going to be the ones who will be able to kind of identify that right away. So they'll be able to walk you through from initial conversations to meetings with senior individuals with the health system, and finally through negotiation of a contract and implementation. So it's a long process. It could take up to a year. So just want to warn you as much as we want to move fast. And the third thing is be easy to work with, right? So if you get one thing out of this list, make it this. So AI is extremely complex. So we don't need to introduce any additional complexity here. We want to be super easy to work with. So how do we do that? So one of the things that you want to do to keep things simple is when you're doing your presentations, have a really tight deck, 7 to 10 slides max. You could have an appendix at the end for anything that may come up in that conversation organically. And again, if you don't get to it, that's great. You want to keep it short. And you want to focus on 1 or 2 features or ideas. What's the big idea behind your company? So ideally, you're striving for a single idea clearly expressed. And this is one of the characteristics that you see throughout many successful companies. I think Apple's a great example. Let's go way back to the iPod, 1,000 songs in your pocket, very tight presentation. You know exactly what you're getting, and it's a big idea. But again, you want to keep it simple, one at a time, right? Leave time for questions. And when it comes to contracting, follow the lead of the health system. So if they have a certain way of doing things and you want to move things along as quickly as possible while introducing a highly complex product to the market, let them lead the way on that. And one other thing I want to mention is pilot projects. So I've worked with a number of startups that had a lot of success in this area. So that really, I've seen 2 really good ways of doing this. So one, I call this the freemium, and I obviously don't recommend this to every company, but if you could set up a trial period, let's say it's 6 months for a hospital to test out your product, it's very low risk for them, gives them a chance to try it out, see if it's a good fit. And one of the things that I've recommended is to have a seamless and triggered process. So if those 6 months go by, everyone's happy, it automatically converts to a paid engagement, long-term agreement with the customer. Now that allows them, like I said, to eliminate a lot of the risk associated with working with a new company. And that's been very successful. I guess number 2 is to try that a little bit differently. That's moving away from the freemium model. I've worked with one company that offered their product at a 50% discount. So for the monthly fee for the first 6 months before converting into the paid agreement. And that was very successful. Still low risk for the hospital, allows you to bring in some revenue while you're building your team and growing your company. And then ultimately, it's still a very low price for the customer. It's cost effective. So you're eliminating a lot of those barriers. I did promise before I close out 1 piece of tactical advice. And so when you're doing your outreach, right, there's a million ways to do it now, millions of different channels. LinkedIn seems to work really well. I've had a great experience with that, messaging and seeing if customers are interested in those early conversations and setting up those meetings and promising, let's do a quick demo. But really I did a webinar with Rachel last month where we spoke at length on this topic, LinkedIn versus email. So I'll refer you to that. It's called Winning and Keeping Health Systems as Clients. And we discussed the pros and cons of that. And really the pro is that everyone goes to LinkedIn to make connections, to learn new things. They don't necessarily want a sales pitch in their work email because that's where they go to do work. So.
Love it. And again, it just all ties back to knowing your audience, right? Whether you're doing that 6 month for 50% off or a freemium model at first and converting, what are the needs of your customer and what works for them in order for them to be able to find a way to get you into their procurement system. So it's not just about the product, but it's like, how does this work for them to satisfy their business needs? So I love that. Scott, you've worked on evaluating different vendors quite a bit. how do you do this, and how would a health system typically evaluate an AI vendor?
Yeah, great question. And I think that Joe and Rachel have really given some really great advice for working with the health systems. One of the things that I kind of live by is the idea of, in God we trust, all others must bring data. And so when we're evaluating a vendor, we want to see, are you able to quantify the problem? Are you able to show us data that this is actually something that works? Are you able to establish an ROI up front? And part of that is really kind of establishing, well, what is our current state? Is this really a problem that we're facing as an organization? And that helps that when you're piloting something that you can actually measure and see, yes, this has had an impact in that thing that we were trying to improve or that we were trying to do. One of the things that I like to see is, again, kind of this analogy with medications and like a package insert for a medication that says indication, side effects, uses, and stuff like that is a model brief. And so for these AI models, having some information on a fact sheet about what data was used to train the model, what are some of the intended uses or potential side effects or issues that could arise from using this, looking at fairness metrics, what are the maintenance requirements for the model, just kind of diving into those kinds of things that you would want to know or show when using this model, because it's going to be a new thing. It would be similar to a prescriber prescribing a new drug. They want to know what's the mechanism of action and those kinds of things. And then the other thing that I cannot stress enough is cybersecurity. Like, you need to have airtight cybersecurity and systems architecture. Any vendor that we evaluate, the first thing they do is they go through a software architecture and security review. We look at all the issues that have happened recently, especially with like Ascension Healthcare. Cybersecurity is like number one on the list of things for healthcare organizations right now, because that can really bring them to their knees. So that's really, really important. And when you're implementing new technologies or integrations with like these AI software, you have to show that you have rock solid cybersecurity and privacy stuff in place.
Yeah, I couldn't emphasize that one more. You know, you could have the best solution that has the ability to make such a fundamental impact, but if you can't do that in a way that protects privacy, if you can't do that in a way that isn't secure, then there's no one out there that's gonna buy that. Fantastic. We're getting to the point where I would love to be able to do some of the questions in the Q&A, but maybe Rachel, one last thought from you in terms of how do you set yourself apart then in what's going to be an increasingly competitive landscape?
Absolutely. So I think in addition to covering those basic areas that Joe and Scott have spoken about, if you can customize your pitch to a particular health system, I think that can really help to differentiate you. So instead of talking about the problem you're solving generally, if you're able to go into your conversation with the decision maker, having already gathered health system specific evidence from their institution, from other folks who you've spoken to, and really build that into your deck so you can talk about how that problem manifests itself at their institution, that's going to help to differentiate you. Similarly, when you're articulating the financial ROI, if you're able to make assumptions in that ROI specific to that health system so it's more realistic. And then when you're showing case studies, try to pick a case study that's fairly analogous to the health system that you are speaking to. And then I think similarly, when you're talking about the ways that you don't bring additional risk, whether that's risk from your solution not working or risk from data breaches, if you can customize that story to the health system too, right? Maybe look up if they have had data breaches in the past and say, oh, I understand you had this situation recently. We want to make sure we don't have a repeat of that. And here are the things that we've done to protect you. I think those things will show the person you're talking to that you've really done your homework and that you're not just giving a generic pitch, but that you're really committed to a partnership with them.
Love it. That's fantastic. Thank you. everyone, thank you so much for sticking with us for close to an hour now. Just to wrap up a little bit, we want to respect everyone's time. No question will go ignored. We might not get to it right now, but we're happy to provide follow-ups. We have some more information for you in a second on what the follow-ups are going to look like. So I'm going to go into a couple of questions in the Q&A here. Susie asked a question about, are there specific places we can go to learn more about how AI is currently being implemented within healthcare and not just theoretical use cases? My very quick answer to that is subscribe to DHI and get that in your inbox every week, because we will, oftentimes there will be examples of that, but we will have some information to share out with you. Aaron Limoges, and I'm going to apologize in advance if I'm not pronouncing someone's name correctly, has a great question, which is, the US population is split roughly 50-50 between urban and rural areas. Is AI expected to impact health disparities in urban versus rural areas? Do healthcare systems in rural areas have a slower rate of adoption of AI-based tools? And I'm just going to throw that out to the panel here. Urban versus rural, AI impacts concerns about equity, equitability. It's clearly getting late for me, but who wants to tackle that one?
I'd be happy to.
Oh, go ahead.
Go ahead, Rachel.
Okay, I don't have data on this, but one of the differences I see between urban and more rural health systems is in urban areas, there's more competition between health systems because you're likely to have multiple health systems in a city, whereas in rural areas, you don't have that. And so where there's more competition, there's competition for patients and there's competition for clinicians. And so I think that health systems in more urban areas are more likely to feel more motivation to implement some of these new technologies that can help with shortages, that can help with burnout, whereas health systems in more rural areas, they may be more inclined to wait for other folks to kind of lead and prove out the use cases versus being at the front of the line. Go ahead, Scott.
And I think this is going to be one of those things that will be really interesting to see how it plays out over time, because there's different things that could happen here. One is that right now we see health disparities between rural and urban on the patient level. And it'll be interesting to see as like more rural centers are closing and becoming like pharmacy deserts or only critical access kind of stuff. And now that we have more telehealth, it's now becoming competition across the nation of like, it's not just go to whatever's closest to you, but you can get telehealth from whatever location anywhere in the nation, really. So the idea is that that could help bridge the gap on a patient level between rural and urban is through like telehealth stuff. But where it also gets really interesting is with the adoption of AI and the potential for like efficiency gains and cost gains and patient outcome improvement and everything, is are we going to start seeing a gap between organizations, between the haves and the have-nots? Are we going to start seeing an increase in disparity in one area, but we've seen a decrease in disparities in another area, and we're just shifting it around? So it will be really interesting to see how that all kind of comes to fruition in the marketplace and in society.
I have one last, I was going to laugh and chuckle and say a lightweight question, but it's probably not. Does or should government have a role in how AI is applied and managed in healthcare systems?
Yes.
You did an amazing job of ending us exactly on time. That was perfect. Thank you. Just a reminder, everyone, again, thank you. This has been a brilliant hour. Tomorrow, we will be sending out a link to this video, assets that we have talked about, some of those examples and other links that we mentioned in terms of data and references that we used in some of our anecdotes and examples. And we'll take these questions that are currently sort of sitting in the parking lot in the Q&A and endeavor to get some answers to you folks as well. and just wanted to say thank you to everyone. And we're looking forward to having many of your faces back in the next roundtable that we do. And please subscribe to DHI, and you'll get a lot more of this type of content in your mailbox every week. Panelists, thank you so much. All of your thoughts and expertise and time is very, very much appreciated.